Hi, I'm Nick Wright, and I'd heard that you've been looking into the fascinating world of medical hypnosis, so I thought I'd pop along for a few minutes and throw something else into the mix, and that something else are neurological disorders. So what is a neurological disorder? Well, it can be described as any health condition relating to the nervous system. So any injury or disease of the central or peripheral nervous system which results in dysfunction or disease. There are over 600 neurological disorders currently known, and for the most part, treatment options are very, very limited. The ones I'd like to mention are those that relate to human movement, so Parkinson's disease, dystonia, essential tremor, Bell's palsy, and the like. Can also include things like ME and MS. For the past decade, I've been working extensively with these conditions, using hypnosis and a few other techniques, and have had great success in helping patients to move forward with their lives and have a better quality of life. Diagnosis for most of these conditions really doesn't exist. Patients present to their GP with the symptoms, and after various tests for other known conditions that can relate to those symptoms, they're then told that they have got one of these neurological conditions. And after that, as I said, treatment options are very, very limited. Now, I'm sure you all know of someone with one of these conditions, particularly Parkinson's, as it is such a prevalent disease in this country. It is also known as a progressive disease, which means it gets worse with time. So what can we do as hypnotherapists to be able to help these patients? Well, first of all, let's look at how these diseases may affect somebody on a psychological basis. There's going to be fear, anxiety, stress, depression, loss of self-worth, maybe even embarrassment to go outside. Now, some of those words I've used you're already familiar with, and as hypnotherapists, with the knowledge that you have now, you can help people with those conditions. But it goes further than that. Once we've helped these patients with the conditions that you already know, we can look at the actual disease itself and use techniques which you already know, like guided imagery, for instance. So how do these diseases affect people on a day-to-day basis in terms of human movement? You take someone with Parkinson's, for instance, and I'm sure you've all seen people shuffling around with that poor movement. Their handwriting becomes much smaller. They have difficulty in breathing, swallowing, eating, drinking. Normal day-to-day tasks that we take for granted become very difficult for them. We can help with guided imagery to help them through, to help them have a better quality of life. At a deeper level, this movement, this poor movement that Parkinson's patients suffer from, is caused by a lack of dopamine. Now, dopamine is a very important neurotransmitter. It helps to give people controlled movement. Just imagine for a moment that you all want to touch your nose. You can all do it, but how do you know when to stop? This is because there are two very important neurotransmitters active in the brain. Dopamine I've mentioned, but the other one is called acetylcholine. And between them, they help coordinate our movement. It's a bit like a seesaw. You imagine a seesaw with a bucket full of acetylcholine on one side and a bucket full of dopamine on the other. And when the two are evenly balanced, you have controlled movement. But reduce that dopamine and the seesaw tilts to one side, resulting in jerky movement. Now, through guided imagery and other techniques that I've developed over the last decade, you can help these patients bring back a better quality of life. What you're actually doing is helping the brain find new neural pathways. If we want to travel from A to B in a car, it's very easy. We hop on the motorway and off we go. It's the fastest route. But what happens if that motorway is blocked? What happens if we then have to find another route, an A road or a B road? At first, you're unsure of your journey. You're unsure of the junctions, the corners, and the first time you do it can be very slow. But as time goes on and you continue down that route day after day, you get faster. It becomes more familiar to you until eventually it's as familiar as the motorway. Maybe not as fast, but certainly a smoother journey. And that's how we can help, as hypnotherapists, people with these neurological disorders to have a better quality of life. We can't cure Parkinson's, but we can certainly help and possibly even slow down the onset. It's a fascinating subject and a fascinating area to work, if that's where you'd like to work. Now, I've been working with these conditions for the past 10 years, and in that time I've put together a CPD training course, a one-day course, which you could all go on if you wanted to learn how to work with these techniques, to work with specialist hypnotherapy techniques, specialist guided imagery techniques, and also move in to what are known as psychosensory therapies. A fascinating area to work and a fascinating people to work with. So I hope you've enjoyed my very short introduction into some of the things that you can help people with when you look at neurological disorders. And I'm sure that there will be a course in your area very, very soon. And if you'd like to come on it, I'd love to see you there. So thanks for listening. Have a brilliant day, and maybe I'll see you soon. Bye for now.